Today we're going to talk about how EMDR therapy can be more tailored to neurodivergent folks. When we're doing EMDR therapy, we have to be particularly careful around autistic and ADHD folks and other neurodivergent populations like OCD, but I'm going to talk about mainly autism and ADHD. Now, if you're working with a neurodivergent person and you're sticking to the protocol traditionally the way it is, it doesn't usually work out, and that's because the person could be easily flooded with anxiety and go into overload. One of the ways to make EMDR therapy more neurodivergent friendly, let's talk about these babies. These are buzzers. These are for bilateral stimulation. I won't go too much what they do, but we use them. They go bzz, bzz, bzz in each hand, and it's supposed to help your brain process when you're going through difficult emotions or even positive emotions. Now, traditionally, we're supposed to slow down the buzzers when you're putting in positive resources, but when you're going through your trauma, you're supposed to do it fast. Now, with ADHD folks, they love to crank it up all the way. Now, with autistic folks, usually they tend to be more sensitive. So as a neurodivergent affirming therapist, what you would do is you would give them the buzzers, the client, and you would let them decide the speed they want. Maybe if you're doing calm, safe place, the ADHD person wants to do it really fast. Or maybe the buzzers are too much. You know, like I've seen some autistic people, for instance, and they prefer maybe something subtle like this. Something else you could offer the client is ask them what their stimming is, and they can use their stimming when they're processing those tough emotions or resourcing. Now, a really important note when you're working with ADHD folks in particular is to be patient between those sets. I'm an ADHDer myself. A lot of us tend to verbally process. And you know what else that we tend to do is experience a lot of shame around talking too much. And sometimes we can feel rushed in EMDR in the client seat. Get caught up in, how much counting between the sets. And when you ask as the therapist, what are you noticing? Let them take their time, And if they're totally off topic, bring them back on target. If they're talking about their grocery list, right? Like bringing back to the original image. And when you think I'm not good enough, what do you notice? You could do that. But be patient between those sets. A disclaimer, I'm not certified in EMDR. I'm actually certified in brain spotting, which is super similar. But I'm EMDR trained. I'm still learning a lot. But, kind of surprisingly, there's not a lot of therapists out there that are neuroaffirming. And EMDR has become very popular for a lot of therapists. So I think it's really important to be more aware when you're working with certain populations, because not all brains are the same.